My name is Nathaniel Du. I'm a general and vascular surgeon. I work in the Goshen Health system primarily in the surgery department with general surgery. I also do endoscopy and with the heart and vascular group. I see all sorts of patients from pediatrics up to the older population for both preoperative, postoperative, and surgeries in general, both office and clinic, small moles and things to large surgeries in the hospital. I also do endoscopy, both upper and lower endoscopies, as well as a large variety of vascular interventions, both open surgeries as well as minimally invasive endovascular interventions. Before a referring provider would send us a patient, it's helpful to have both laboratory studies as well as imaging, potentially pathology, to guide our decision-making in whether the patient will require surgery. My preferred method of communication with the referring physician kind of depends on the complexity of the patient. If the patient has a long, complicated history, it's helpful, I think, to have a verbal conversation in regards to the situation. Otherwise, a copy of the medical records from the referring provider's office would be sufficient. So if the referring provider sends a patient for consultation and evaluation, we'll send a copy of the note as well as a letter to the referring provider for that visit, as well as any visits afterwards, whether the patient requires surgery or does not require surgery. I believe one of the unique aspects of surgery or vascular care at Goshen Health is that we have a collaborative agreement with multi-specialties in regards to vascular surgery. We have weekly conferences between the vascular surgeons, interventional radiology, as well as interventional cardiology. And all our patients are discussed in this weekly conference to determine what's the best means of intervention for these patients. The question may arise as to whether a patient should be referred to me or to interventional radiology, even though I may not be the one that would be performing the initial surgery. It's okay to refer the patients over to myself or my office, and then we discuss it in our multidisciplinary conference.